I'm Ashley, and today I'll be talking to you about euthanasia. Would you like to learn a little about euthanasia? Have you ever heard of euthanasia? If not, here's a chance to learn about euthanasia. My goal today is to inform you on why I agree to euthanasia. I am credible to give a speech today because I've talked about this speech numerous times, and I feel like euthanasia should be legal. While talking about euthanasia, I will talk to you about what is euthanasia, the forms of euthanasia, the treatments, and why I believe it should be legal. To die proudly when it is no longer possible to live proudly. Death freely choosing death at the right time. Brightly and cheerfully accomplished amid children and witnesses. Then a real farewell is still possible, as the one who has taken leave is still there. Also a real estimate of what one had wished, drawing the sum of one's life. Euthanasia does deal with death and has many forms to go through, according to euthanasia quotes. Euthanasia should be legal today only to the people that are suffering and having severe problems, such as illnesses and cancer. There are many pros about euthanasia that people are suffering today. Not everyone wants to go through pain and agony in their life, so they want to choose their life and end it with euthanasia. According to euthanasia. What is euthanasia? People explain in many ways what euthanasia is, but the right way is to go online and look up euthanasia. Euthanasia is a termination of a very sick person in order to relieve them from suffering, according to BBC News. When a person cannot be cured in their condition, that is euthanasia. Euthanasia is a Greek word that is also called euthanasia, which people hear as death. When people hear the word, they all turn around and pray for the individuals that passed away, or their stomachs end up turning. There have been numerous controversies about euthanasia and how people do not agree on euthanasia, and some do agree, which I think they should agree. People do not have the right to do what is best for them, for their family. This is why euthanasia should happen. Euthanasia has many forms that will be explained later on this paper, and how the patient can or will be affected by them. I will explain what the forms are of euthanasia, since there are more than one form. The first form is active and passive euthanasia. This means the person is openly and carefully causes the patient's death, which helps them from suffering. Passive euthanasia is when the doctor or loved ones does not take the patient's life from them and let them suffer. Even if the loved ones or doctors does not kill the patient, still knows that they will die sometimes rather than using the active euthanasia. Active euthanasia is when someone overdoses or someone decides to kill them instead of dying on their own. Such as the syringe right here. They will fill the syringe up and they will inject it into their vein. Once it hits their vein, they will reach God's hands. Passive euthanasia gives you two treatments: withdrawing treatments or withholding the treatments. With the withdrawing the treatments, that is when the person is hooked up to the machine and is on life support to stay alive so they die naturally. Withholding the treatment, it is painfully just killing them or so they stop suffering. Passive euthanasia is when the doctor stops helping the patient live, such as pulling the life support machines, disconnecting the feeding tube, or refuse to give them the right medicine, according to BBC News. The second form of euthanasia is voluntary and involuntary euthanasia. Voluntary euthanasia is when it occurs when the appeal of the person who dies. It also means that the patient says he or she wants to die and does. This means they want more drugs so they can die, asking to pull the life support switch and does not eat. Non-voluntary euthanasia means the person is in serious condition and cannot make their own decision. The third form of euthanasia is DNR. DNR stands for Do Not Resuscitate. This means that the doctor or nurses do not resuscitate if the patient's heart suddenly stops, according to BBC. Do not resuscitate is one of the forms of passive euthanasia. While the patient is conscious, the nurse tells them if they would like to sign a piece of paper that says DNR. But if the people cannot sign this DNR with serious condition, the family does it for them. Some patients sign the DNR so they don't have to go through all the pain and agony. I remember when my grandma was in the hospital with a stroke and a mini heart attack, and they asked her if she wanted to sign it, and she did. She told me that she's too old and does not want to go through all of that pain and rather just pass away. When she told me, I was crying, but I understand what she was telling me. I will tell you some pros about euthanasia. One is that the patient would not have to suffer anymore in their life due to their illnesses, such as cancer and diseases. For the patient to go through all the pain and suffering, it would be just too hard on them, and they could just end their life on the good side before anything else bad happens. Sometimes the patient does not even know what is going on, as being unconscious for days or weeks, so it would make them fall into God's right hands. I will explain my opinion and why I think it should be legal. I feel like euthanasia should be legal in all states, as we can stop the people from suffering. This is no way that a patient needs to suffer until they naturally die. Why would a family member want to see their loved ones turn blue before they die? I have seen my grandpa turn blue. Once we saw that happening, we had to unpull the life support, and he entered God's world. If you have been watching the news the past 6 months, Brittany Mayer decided to die with dignity at age 29. She had brain cancer and wanted to use euthanasia, and she did. Ms. Mayer knew she was dying and knew her conditions were unbearable, so they used a medicine such as euthanasia. She is now in peace and in God's hand, where her family wanted her to be. As stated, patients do not want to live life suffering, so they should have the ability to end their life on the good side, rather than waiting till it gets worse. Euthanasia is a way to relieve a patient by suffering and to go to heaven. There are many forms of euthanasia, such as active, passive, voluntary, and involuntary euthanasia. Thank you for listening, and I really appreciate you guys listening to all my speeches this semester. Hope you enjoyed.
Good job, Ashley.
Good job.
Good job.